Hi, I'm Barbara Kreider, and I'm with York County Community Action Corporation. And one of our programs is York County Community Healthcare. And we are healthcare for the homeless program and primary care for public housing residents. And we've been in operation for about 5 years. 2 years ago, we moved our health center from Spruce Street, which is the main facility of the Community Action Agency, to a new facility in South Sanford. And we're currently leasing that facility. And we're seeking an appropriation to help us actually purchase the building. And the reason behind that is that we're paying about $130,000 a year in lease costs right now. And we have the building under contract to purchase. And so in a couple years, we're going to have to purchase it for $1.3 million. And so we're trying to figure out a way that we can find funds to purchase the building. The sooner the better, because if we were able to buy it outright, we could put that money right back into patient services. And we think, you know, these are rough calculations, but about $10 of every patient visit goes towards our lease payment. So we think if we could buy the building outright, that we could serve conservatively about 900, not necessarily additional patients, but 900 additional patient visits in a year. And we would probably do that by adding a part-time physician and a part-time dentist and support staff. So that's what we would use the budget relief that we would get, that money would go back into patient services. I know that bricks and mortar projects may not be common for direct appropriations, but we're really seeing it more as operational money or really patient services money. We're not eligible for USDA community facilities grant or loan because Sanford is not rural enough. And certainly we could and probably will, if we're unsuccessful with this effort, you know, we can do a capital campaign. But we work in partnership with the York County Shelters programs, and we have talked with them, and given the economy, we're going to the same donors over and over again, and ultimately if they're going to give to the health center, they may not have the money to give to the shelter, and there's a finite pool of donors. So we're trying to be creative in a way that will help us serve more patients. And my final point is that, you know, we're going to have to buy the building. So if we have to finance it conservatively, we think we'll be paying about $1.7 million in interest only, and it's public money. So we think that it's a prudent use of public money to help us purchase the building and serve more patients.
Thank you.